Hello, my name is Judson Sprandell II. I am an Ohio chiropractic physician. I've been in practice for 38 years. I want to thank ChiroSecure for inviting me on the show and to discuss my experience in treating veterans for the past 8 years. My talk today is I have four important points to cover today. Is number one is DCs need to be certified through the Optum TPA of the Department of Veteran Affairs. Number two is veterans need to be certified and credentialed through the VA to receive chiropractic or acupuncture treatment. The third issue is that veterans need to know that they have the right to seek chiropractic or acupuncture treatment. And the fourth issue we'll talk about today is DC documentation for the veterans. So let's go to the PowerPoint. Now, veterans can seek evidence-based non-pharmaceutical chiropractic treatment in the community. Okay, this is what the discussion will be today. All right. My information today will be based upon our experience in treating veterans for the past 8 years. First question we'll cover is, does the VA provide coverage for chiropractic treatment and acupuncture? Well, the answer is yes. This started in 2002. Public Law 107-135 ensured that chiropractic would become a permanent benefit for recipients for veterans healthcare services. And as a result of this law, chiropractic care was gradually added to more than 30 VA medical centers. The issue that we have here is that nobody knew that this happened. And I didn't know this happened either. Okay. What is pretty great in 2018, a directive was established by the VA. It was called 1210 Chiropractic Care. And this is actually written in the website for the VA. And it states that chiropractic care is included in the medical benefits package, the standard health benefit plan generally available to enrolled veterans. And actually, the wording actually is listed within the website. And it says within the VA website, the chiropractic care is included in the VA Joint Commission pain management standards. The evidence shows that patients receive chiropractic care are less likely to use other healthcare services that are more costly and greater risk, such as opioid medication, spinal imaging and injections, and elective spinal surgeries. And it states that patients receiving chiropractic care have lower healthcare costs for episodes of non-operative spine-related disorders. So this documentation is throughout the country. I mean, this is just not localized in Ohio. I mean, it should be across the country. Again, I don't think many of our DC colleagues know that fact. Okay. One problem that we have across the country, including here in Ohio, is veterans do not know they have the right to choose, or they even have a benefit coverage for non-pharmaceutical chiropractic care or acupuncture. So what should be done? Basically, local action steps are needed. DCs who treat veterans should have the foundation for chiropractic services, infographics, and articles readily available to distribute to patients in the office and on social media. The foundation for chiropractic progress, the information is just top notch. It's very easy to put on your social media, and it's really great to give patients. I am attaching, I have examples of the Foundation for Chiropractic Progress infograms and brochures, and these we'll go over here briefly. The two brochures are Chiropractic Care for Veterans and Chiropractic for Veterans. The infograms include caring for our military, combating the opioid epidemic, chiropractic on the front line for veterans, and the opioid white paper. The other infograms that they have that deals with the veterans is veterans with chronic pain, veterans opioid related overdoses, veterans with lower back pain, chiropractic care for veterans, veterans and back pain, and finding relief after battle. These are the infograms that I found through the Foundation of Chiropractic Progress that deal with veterans. So examples of what they look like are attached here. They are just very top-notch, very well done. And what I've done is I've sent copies of all of these infographics to ChiroSecure. And after the show, if you need to get the copies of these infographics, then contact ChiroSecure. They'll send them to you. Or better yet, hopefully you're all members of the Foundation for Chiropractic Progress. they have these. There's many more than just veteran infograms and brochures. All you have to do is hit the print materials, and you can find these on their website, and they're easily downloaded for your office or on social media. The next example that I have is a brochure. It's a one-page brochure. Talks about chiropractic care and treating veterans, and also talks about that 1210 chiropractic directive. Yeah, as you can see, they're very well done. And again, you can get these through being a member of F4CP or join with F4CP, or you can contact ChiroSecure and they will send you copies of these great tools to use as education pieces. Now, the Foundation for Chiropractic Progress has an awesome white paper regarding veterans. It is titled "The Future of Wellness: How Chiropractic Care is Helping to Improve the Lives of Veterans." There are many topics which we'll discuss in a minute, but this white paper you can use in office as an educational piece. You can take it to any type of meetings, or even talk to politicians. This is very well done, and the paper talks about all the positive effects of the chiropractic profession can provide for our veterans. Now, this paper includes statements such as nearly 20% of Americans suffer from chronic pain, including 65% of veterans. Chiropractic care is on the rise and is making a difference, especially with our veterans. Other additional topics include that it states that the VA and government agencies are recognizing that chiropractic care is a safe and drug-free solution for veterans to manage pain. Veterans suffer from chronic pain at a much higher rate than the general public. More and more studies performed by the VA and other military health officials regarding chronic pain in veterans are finding that a chiropractic care path should be pursued earlier and more often. Hallelujah with that statement. Additional information states that chiropractic care has a role to play in decreasing opioid use and abuse. Research has shown that the percentage of veterans receiving opioid prescriptions was lower than those who have received chiropractic care. Now, this paper is referenced. There's many references on the back page. It's a very good article a paper to send to the printer, print them up, and put them in your office, or send out on social media, or just to take with you to meetings. F4CP has the tools for us to educate our veterans. All right. Let's see, I went the wrong way there. Okay, so we need some local action, or local DC action steps are necessary. And as a part of it, educating our veterans, what you need to do is you locate the military VA centers, such as the Veterans of Foreign Wars, Wounded Warrior Facilities, American Legion, or others in your local area. Upon doing this, you want to request a meeting or an opportunity to inform the attendees that the veterans have chiropractic acupuncture benefit package. Now, these facilities have a commander, and I did contact the American Legion. They were very open-armed to our information. I had a meeting with the commander, but very well. He accepted all our F4CP information. But the key here is I didn't go into the American Legion as an individual doc. I went in there as a representative of my local chiropractic district, which I represent 5 counties in Ohio. That seemed to go over very well, because I was not saying, come send all your veterans to me. I told them that they should be sent to chiropractors who are located closer to the veterans. And what we have a local website that I instructed them to contact the website and find a DC closer to them. Now, prior to this meeting, we created a veteran facilities information packet. Now, I sent this packet to ChiroSecure, and if anybody needs it, they can contact ChiroSecure or contact me, and I can send it to you. But the information packet is a description of chiropractic benefit. It has a veterans poster. We have several brochures that I use from the Foundation for Chiropractic Progress. And what the American Legion did for us is that they put the information on a closed circuit TV. So during when their lunch and dinner and cocktails, this program was going on the whole day. So, but still, there's definitely needs more work to do on this issue. Okay. Now, I also have a few questions where I don't have answers for. And these we'll all have to work on maybe for the next show. But if you pull up the VA website, the chiropractic acupuncture benefit is not easily seen. You click the healthcare benefits. There's a whole list of benefits, but we're not listed. The only way the veteran can find us if they go into the search mode and type in chiropractic or acupuncture, and then the information will come out for them. But they don't. Again, they don't know. So I mean, I sent a request to get this changed. It wasn't done, so we're going to have to do it again. So I think that our benefit of chiropractic care and acupuncture should be listed right underneath, right with all the other benefits. It's a step in the right direction if they do this. Now, addressing what a veteran seeking chiropractic care, the first thing they have to do, they have to be certified through the VA to obtain coverage. Once they're certified through the VA, the veteran can either request chiropractic care or acupuncture, or ask their primary care physician or their pain management physician to go to a chiropractor. And I tell you, most of the time, the primary care physician and the pain management physician will agree. I've only had one case where a veteran had a problem, and we were able to fix that problem. So once everything is certified and the veteran requests the care and obtains the consultation, what happens once they get the approval after the consultation, okay, the VA facility will then call and fax the authorization to our office for the treatment request that was agreed upon by the primary care or the pain management. The authorization will list the number of treatments approved, provide copies of the medical records, which includes diagnostic testing, and will list the VA diagnoses. Okay. Now, another question I have, which I don't know if I have the right answer for, is does the veteran have the right to choose his or her physician or physician type? I would say the answer would be yes. However, there was a veteran who was instructed that they could not go to their community chiropractor. They had to go to the DCs that were on staff. So that veteran did not consult the community chiro. But I instructed that chiropractor that if the veteran has to wait more than 30 days, then to see the staff chiropractor, then that veteran can go to a community chiropractor. Okay. Some of the criteria for the VA is kind of hard to get through, to tell you the truth. Okay. Now there is a proximity requirement for our VA veterans to consult a community chiropractic physician. It is 40 miles. Usually they say that if your veteran is more than 40 miles away, that they can consult a local chiropractor. Well, that's really not etched in stone. I think if the veteran can request an individual chiropractor, usually those requests are authorized. But again, this is another issue that's kind of up in the air. All right. Now, regarding active duty military personnel or ADMPs, they do have access to chiropractic and acupuncture in various military facilities. My question is that this right should be extended to all U.S. military facilities. Don't you agree? My question I have for the VA too is, will our active duty personnel have the right to seek chiropractic care in the community? Or will the families have the right to seek us in the community? Now, the active duty military personnel have an insurance company called TRICARE. Now, TRICARE has made a statement that they were going to improve their benefit packages for chiropractic care in 2020 and 2021. Obviously, that didn't happen. Hopefully, in 2021, this occurs. I hope that there's a timeline again with this issue, but we're going to have to follow through with this and see what happens. Now, another issue in our talking points is there a DC credentialing requirement through the VA with the third-party administrator Optum? And of course, the answer is yes. I have the certification process outlined in the next couple of slides, but Optum is the current third-party pay administrator. It used to be TriWest. They discontinued the use of TriWest in 2019, or starting of 2020. Optum is now in charge of the third-party administration of chiropractic care for the VA. So what a DC needs to do, they need to visit the Optum VA Community Care Network. There's a link there I put for you to click on. The, hang on 1 second. The certification process is not smooth by all means. Our certification process took 4 months. We started in January 2020 and we didn't get approved till May of 2020. This is not a smooth process. You have to be patient and you have to be persistent. We consistently checked on the status. Checked on the status, and finally we were authorized in May of 2020. So this is not a smooth process, but please be persistent if you want to treat veterans. The only way you can treat a veteran is be certified through Optum. Now, again, the certification process, you click the link, you click the provider button, then click the button that says join the network PDF, and then you click the join the VA community care network link, and then you follow instructions. This is pretty straightforward once you get into the Optum website, all right? So another question, what chiropractic procedures and treatments does Optum cover? Well, covered chiropractic procedures and treatments, it is my understanding that there are Washington, D.C. recommended chiropractic and acupuncture treatment plans. I don't know who established these, but we have to work within their parameters. The number of authorized treatments varies in number and duration. However, per my experience, the treatment frequency recommendations are based upon the primary care physician and or the pain management rehabilitation MD's consultation. Now, when you receive the authorization by fax, usually the initial chiropractic authorization is for 12 chiropractic treatments within the fax or with a 90-day period. Within the fax, there are codes that they will cover. They cover most of our examination codes, manipulation codes, and therapy codes. Okay. Now, additional care is approved, and usually the second chiropractic authorization is 6 chiropractic visits over 30 days, and the third authorization is 8 chiropractic visits over 180 days. These treatment plans, I would think, will change frequently. Like I said, I don't know who established these, and we'll have to see what happens. But we'll get into the asking for additional care here in a minute. Now, they will send a authorization for acupuncture too, and usually, the initial acupuncture authorization is for 12 treatments over 45 days. They list the codes that they cover and notice that there's no manipulation codes. This becomes a problem for the chiropractic physician who is also certified to do acupuncture. We've had discussions with the VA before, and it appears that they have one way of approving the chiropractic care and another way of doing the acupuncture care. I'm certified to do the acupuncture in addition to chiropractic, and I do very well by treating the veteran with both. This has to be an educational process. The VA sometimes will tell a veteran, well, we want to try chiropractic first. If it doesn't work, then we'll do acupuncture. That doesn't really work well with me. If I can do both, I do a lot better. So we'll see how this goes. So let's go to the next one. So what documentation does the VA require? The initial report is a recommendation that I have, and it should be submitted after the initial evaluation within that first week. It's very important for the VA to receive the initial report because the initial report outlines the initial visit. Once the initial visit is registered through the VA, the claim is called open, which means is now the claim is open and they're going to start the process of reimbursement. So it's very important that this goes out to them, and the initial evaluation has to be done well. We can't provide poor documentation. Okay, your notes have to be awesome. We can't give them chicken scratch. I've seen several examples of office notes, especially how where our colleagues are not doing real well with these documentation. The VA does request your office notes. We send them timely. In my office, I use a diary and speaking, and my notes are done within 24 hours of completion of the visit. My notes are easily read. we have no problems with sending the notes, and they've been pretty happy with us. Update and progress reports need to be completed with emphasis on how well the veteran is doing. And again, DCs cannot support or send in poor documentation. But the office notes is so important for the veteran to or for you to outline the improvement, and it's so important for the veteran to tell them that they're improved. So how do we document improvements? It's very simple. It's your pain scales, your Western disabilities, or just statements. Well, now the patient can stand. He couldn't even help his wife do the dishes. Now he's able to stand because the numbness in his legs is gone due to your treatment plan. This is definitely documentation that they need to hear. The more they see good notes and improvement with our care, the more will be accepted, and maybe we get rid of some of these headaches that we have to deal with. Now, additional visits exceeding the recommended treatment plans can be authorized, but additional treatment requests will be based on the documentation. And as I said before, documentation of the veteran's improvement in the office notes, and also the ability of the veteran to communicate that the chiropractic and or acupuncture treatment is beneficial. These are the criteria that's necessary to obtain approval for your additional authorizations. The veterans' cases are definitely complicated. They are not simple sprain strain injuries. Most veterans have had trouble with for years. Their rate of improvement with our care is definitely slow, but we do get great results with these veterans. But as a veteran's complicated case, I had one veteran who's had 19 surgeries. He had 4 failed back surgeries. He had 9 surgeries on his hands. And one veteran, he was taking 32 pills a day for 10 years. I have another veteran, he was taking 35 pills for year after year. So they are definitely complicated cases. They are not easy to treat, but our veterans need our care, and we can definitely get them off the drugs and stuff that they've been relying upon for years and years and years. Now, on your EOBs, you must have the VA diagnosis listed on the appropriate section. Do not include any other diagnoses. I document my diagnosis of the veteran's condition in the assessment of my initial report. So, because sometimes the authorized diagnosis is pain, it is non-specific pain. I mean, some of the diagnoses are very generic and non-specific, but you still have to use those in your documentation. That's why you put, if I think it's a disc or sciatica or brachial syndromes or any type of thing, those are all listed in my report, my initial report. Okay, now what we've recently found is that you send in your initial report. We were sending the office case notes as we completed the visits, but the local VA said they wanted a whole block of our notes when the treatment plan is coming to an end. So what we have done now, instead of sending the notes on a very frequent basis, once we're getting close to the end of our treatment period, say it's 12 visits, once we get to like 11th visit, we're sending all the notes, and that seems to work with them. It is important to have communication with the VA facility that is sending patients to you. The more you work with them, the more we make it easier for them, the better it is for us. And most importantly, better for the veteran. So when you're billing the manipulation codes, you want to use the AT modifier. And when you're billing physical therapy codes, you want to use the GP modifier. All right. And as I said, additional care is necessary. And most veterans do need additional care. Sometimes the initial authorizations are for 6 visits, which doesn't make much sense to me. But once the improvement is received, or once the veteran receives improvement, my discussion with the veteran is contact the primary care and tell them that you're better, and tell them you're getting better and you want additional care. That is a major plus to get additional care. All right. But additional care is a real problem for us because they need additional care, and the authorization of care can take months, which does hurt the veterans' treatment progress. There is definitely frustration for the veterans when you request additional care due to long delay of authorization. There are cases wherein the veteran has been told that they use up all their visits and they cannot ask for additional care. In one case where he was a Vietnam vet, I treated him on 4 occasions and his pain level went from an 8 to a 1. Pretty awesome. Now, it doesn't happen to me all the time, but it does. It was pretty awesome. And he had an appointment with the pain management, and then pain management physician stated that, well, you have 12 visits, that's all you're going to get. Any additional care, you're going to pay out of pocket. So he came in and says, Judge, I guess I'm going to have to pay after I get done with these block of visits. I said, no, we'll file the appeal. We'll ask you to ask for more, and we were successful in doing that. Okay. I feel that once the veteran improves with our treatment plan, that plan should be authorized. It's all about doing what's right for the veterans. Okay. Again, the additional treatment recommendations are dependent upon veteran improvement with our care. So our solutions, the solution we have is basically education. We need a consistent education campaign, which is I rely upon the Foundation for Chiropractic Progress. They have all the tools we need to document the benefits and cost effectiveness of what we do. Everybody should be a member of FRCP or Foundation for Chiropractic Progress. I don't know why anybody would not be a member of them. It's very easy to use their tools. I think the only way we're going to be successful in obtaining or getting more veterans to come in our offices is to initiate a grassroots effort across the country. I mean, if we can get every veteran to submit the information, or if we get every DC, I'm sorry, to submit the veteran information on the grassroots effort, it'll increase access for all of us. Now, the solution, not only in the veteran arena, or also in our third party or in our insurance arenas, is that these third party payers such as TRICARE, Medicare, and Medicaid must acknowledge that restricting and or providing zero coverage for what we do fuels the opioid drug reliance, drug addiction effects of the opioid epidemic. The third party payers have been told, or there are at least 5 or 6 national guidelines out there saying that insurance benefits should be expanded to non-pharmaceutical chiropractic treatment, acupuncture. However, nobody's listening. So this is an issue that we have to address. If we can get the third-party payers to open up the doors for what we do, it'll help our veterans as well as all our patients. Well, all right, that concludes my presentation. I want to thank ChiroSecure for allowing me to outline the experience I have with veterans. They are a most deserving group of people, and I do whatever I can to help them. If you have any questions, you can submit it to ChiroSecure, and I'll answer them to you. Next week we have Yvette Nicole. She's going to be on our show on next Tuesday. Please click into her. She's got awesome information for us all to use. So anyway, everybody have a good, happy new year. Hopefully 2021 is a lot better than 2020. And I'm signed up for additional shows next year, so we'll talk more about the veterans. Thank you very much for your time.